Here's a question I can't stop thinking about. Is sense of purpose one of the key ingredients that makes occupational therapy effective? I ran a survey of my OT peers earlier this year, and I was pretty shocked that 17% of respondents selected sense of purpose as the main treatment area that they address. This was second only to daily activities, which I traditionally think of as by far our bread and butter. To me, this means that maybe on the ground, therapists have discovered what science is just starting to catch up with. That addressing sense of purpose is one of the most broadly effective areas that we can address as occupational therapy professionals. Today, we are going to look at an article that reveals why sense of purpose may be such a profound lever to pull. And it is just associated with so many health benefits. And after we review this article, we are excited to welcome to the podcast one of occupational therapy's leading thinkers about our role and sense of purpose, Dr. Alix Sleight. Together, we'll unpack the science behind sense of purpose and the small and large ways you can address it in your OT sessions. So let's dive in. Welcome to the OT Potential Podcast, where we review new and influential OT journal articles, then invite on an expert guest to help us pull out actionable takeaways that you can implement in your practice starting today. Welcome to the podcast. I'm your host, Sarah Lyon, and I am a licensed occupational therapist. Before we dive into this big topic of OT and sense of purpose, I wanted to let you know that this podcast may qualify as continuing education for you. You are probably listening to this podcast on a free podcast platform, but to gain CEU credit, you will need to be a member of the OT Potential Club, our OT continuing education platform. Okay, before we patch in Dr. Sleight, let's look at this journal article. The article that we are reviewing today is called Sense of Purpose in Life and Subsequent Physical, Behavioral, and Psychosocial Health, an outcome-wide approach. This article comes to us from the American Journal of Health Promotion, and it was published in 2022. The article begins with this big picture intro to sense of purpose. The authors state that a key next global health opportunity is meeting the needs of our rapidly growing population of older adults. This need has sparked a movement to identify modifiable health assets that uniquely enhance overall health. And one promising avenue for accomplishing this is addressing sense of purpose. Sense of purpose is viewed as a central component of well-being, and it refers to the extent that people see that their lives have meaning, direction, and goals. So what do we already know about sense of purpose? Based on past research, we have seen that higher sense of purpose has been associated with many things, including improved health behaviors such as increased physical activity, increased use of preventative health care, healthier sleep, and reduced drug misuse. It is also associated with improved biological function, such as reduced allostatic load and reduced inflammation. And lastly, it is associated with a lower risk of cardiovascular disease, cognitive impairment, and even mortality. But the studies addressing sense of purpose have had limitations, including using data from small and specific subpopulations, not accounting for potentially confounding factors, having limited ways to assess sense of purpose, and not evaluating whether change in sense of purpose was associated with these improved outcomes. So, bearing all that in mind, what was the intent of this paper? The author's goal was to expand on this current research and then determine this big question of, is positive change in sense of purpose associated with better health outcomes? To answer this question, they tracked 35 indicators of health over 4 years. So what were their methods to do this? The authors used data from the Health and Retirement Study, an ongoing survey of U.S. adults over age 50. Participants are surveyed every 2 years. The baseline data for this study was collected in 2006 and 2008, with follow-ups conducted 4 years later. The final sample size was a whopping 12,998 individuals. So this is clearly a large and robust study. So what measures were they using? Baseline purpose was assessed using the 7-point Purpose in Life subscale of the RIF Psychological Wellbeing Scale. How did they analyze it? The authors used an outcome-wide analytic approach, which allows them to examine the effect of purpose on multiple health outcomes while also adjusting for confounding factors. So what were the results of this massive study? During the 4-year follow-up period, participants in the highest sense of purpose quartile showed the following results compared to participants in the lowest quartile. Again, there are 35 measures that they were tracking. I'm going to go through these because I do think that they're important, and we're going to group them into a couple umbrellas. The first is physical health. So those people in that highest quartile of having a higher sense of purpose showed a 46% reduced risk of mortality, a 23% reduced risk of stroke, a 17% reduced risk of lung disease, and a 28% reduced risk of physical functional limitations. They also had a 16% reduced risk of cognitive impairment. They also had fewer chronic conditions and higher self-rated health. In this umbrella, there was little to no association between sense of purpose and diabetes, hypertension, cancer, heart disease, arthritis, chronic pain, or being overweight. In the health behavior categories, there was a 15% increased likelihood of subsequent engagement in physical activity and a 13% reduced risk of sleep problems. Purpose was not substantially associated with either heavy drinking or smoking. In the umbrella of psychological well-being, purpose was associated with all the factors in this category, including higher positive affect and higher optimism, a lower sense of hopelessness, and a 43% lower risk of depression. In the final umbrella of social factors, purpose was associated with lower risk of loneliness, lower likelihood of infrequent contact with friends. There was no association between sense of purpose and living with a spouse or partner or having contact with children or other family. So those are all 35 factors. You can definitely hear that sense of purpose had a big impact on many of them, but not all of them. These results also still held when controlling for potential confounders, such as baseline purpose, sociodemographics, physical health, and other factors. Okay, headed into this conclusion. By controlling for purpose in the baseline wave, the authors were able to evaluate the impact of changes in purpose, ultimately identifying the health benefits that I just mentioned in these results. One thing that the authors call out is that some of the chronic conditions were not impacted by a change in purpose, but one hypothesis as to why this is just that 4-year follow-up period just may not be a long enough time horizon for a physiological variable to exert the cumulative effects of a sense of purpose. So basically, it just may not be a long enough time to impact things like rates of cancer or stroke. Another thing that the authors call out is that this research did not examine the mechanisms of why a sense of purpose may be associated with so many health benefits. But looking at past research, it has been shown that on a physiological level, purpose is associated with an enhanced ability to recover from negative stimuli, an increased ability to handle daily stressors, decreased impulsivity, enhanced self-efficacy, healthier lipid profiles, and decreased neural conflict when making healthy decisions. So this existing body of work, combined with the additional information provided in this article, shows that a sense of purpose remains a potentially novel way to improve well-being and health in our rapidly aging population. Wow, there is just so much to unpack here. There are so many ways that a sense of purpose impacts our health, but the question is, how do we harness that, and what does that mean for us as OT professionals? And I'm so thankful because I feel like I just found the perfect person to talk to this, and that is Alix G. Sleight, PhD, OTD, MPH, OTRL. Dr. Alix Sleight is an occupational therapist and behavioral scientist. She directs the Cancer Survivorship, Health, and Life Transitions Lab at USC, which focuses on health and quality of life outcomes during cancer survivorship. Dr. Sleight is particularly interested in the ways in which cancer survivors experience everyday activities, health behavior change, post-traumatic growth, self-actualization, and self-transcendence. Dr. Sleight conducts clinical trials as well as cross-sectional and qualitative studies in cancer survivorship. Her research interests include personalized health management interventions for chronic conditions, health-related quality of life, spiritual well-being, health behavior change, and the therapeutic use of self-generated ceremony during major life transitions. Dr. Sleight is also an NEDA certified end-of-life doula. So without further ado, I will patch Alix into this podcast. Welcome to the podcast, Alix. It's great to have you.
Thank you for having me. It's great to be here.
I am so thankful that we're here to talk about purpose. It feels really important for us as occupational therapy professionals. On one hand, this article really showcased just the increased science that we have around sense of purpose and how it's just this amazing lever or protective factor where it has this ripple effect over all these different health conditions. It honestly reminded me a little bit of our sleep episode. Like if you're sleeping well, it's going to help so many things. And same with that higher sense of purpose. So there's amazing science going on. And the other thing that just keeps tickling my brain is I've heard the talk, especially in adolescence, about a declining sense of purpose for our adolescents. I think the stat I heard was in a survey of adolescents that they've done year after year, usually 9% identify with the statement, "My life feels useless." And that was kind of held steady until about 2010. And then between 2010, all of a sudden that spiked and that number doubled.
Wow.
So when you think about all the health benefits associated with sense of purpose, I mean, that just feels really shocking, just face value. But then when you think about all the health benefits, it's definitely something that weighs on our hearts and just makes this topic today feel so important and timely. And I'm excited to get to just all of that and unpack it. But before we get there, I just want to learn about you and how you became interested in sense of purpose. Like I read your bio and what you've written, and you've covered so many different topics and done so many different things, but it all really feels anchored in sense of purpose. So how'd you get there? How'd that interest come?
Yeah.
Tell us about you.
I love that. I've never thought of my work as being all grounded in a sense of purpose until now, but you're right. It kind of has been.
Yeah.
I think, I've always been kind of interested in the big existential questions in a way, probably since I was a little kid. But I've also spent a lot of time face to face with mortality. As an occupational therapist, I've worked pretty much only with cancer survivorship. So a lot of people with a history of cancer who are, struggling, grappling with the big questions because there's nothing like cancer to put you up against your mortality. And then I'm also an end-of-life doula. So I've worked with a fair number of people who are at end of life. And I think when you think enough about death and dying, it leads you to think more about life and living and what it's all supposed to mean.
I have like a billion questions. One logistical, did becoming an OT predate becoming a doula? Mm-hmm. Or what was your journey into OT and then doula?
Oh gosh, I mean, that could be a whole separate podcast. But I think, just working with the cancer population for so many years, I was always thinking about OT's role in end-of-life care. That's actually one of the things that brought me into being an OT to begin with, because I thought there could be such a great role for OT in end-of-life care. And then COVID hit, and I had some personal experiences that put me right up against death and dying. And I realized I just didn't know anything about how to handle it. We don't really get that education the way we used to, right? I mean, we used to learn about death and dying from being surrounded by it, but now it's very sterilized, it's separate. And so I just wanted to be armed to help my patients better, and also just for my personal life to be better prepared to deal with it.
Would you say your interest in sense of purpose, as you've been a professional, has it come from just seeing that as a driving factor, seeing a lack of sense of purpose, thinking about your own sense of purpose? Like has there been like an anchoring interest there for you?
In purpose?
Yes. Yeah. In sense of purpose.
Yeah. I mean, I think if I were to pinpoint when I started thinking about purpose as a crucial component of OT, it was during OT school when I learned about lifestyle redesign. And during my OTD, I developed a lifestyle redesign program for cancer survivors. And what I found was that people really do better across all outcomes if they're talking about purpose and values and meaning the whole time. So one of the first things I learned to do when I was practicing was to do a values checklist. I don't know if you've seen the values checklist before. Mm-hmm. I love it, and I use it all the time in practice. For those who maybe don't know about it, it's a list. It's just a bullet list of every value you could think of. So things like joy, stability, justice, health. And you just ask people to narrow it down to their top 5 things that matter most to them. And for a lot of people, that might be the first time, or at least the first time in a while, that they've really thought about what matters to them. And then the next step is to do an activity. We used to use something called the balance wheel that would actually have people color in slices of a pie to represent the different hours of a day, to just identify, like, how am I really spending my time? If I really value nature, am I ever spending time in nature? Like, is there a misalignment with the things that I value and the way that I'm spending my time? So just seeing how successful that approach was in the clinic during my education, I started to use that in my practice at Cedars-Sinai, where I developed an OT clinic for cancer survivors. And I started there with values and the balance wheel almost all the time. And yeah, it just, people really resonate with it. And I think it's a useful exercise for everybody to do it regularly.
Yeah. Mm-hmm. Yeah, I can see that as such a good grounding, either like eval, first treatment activity for so many of our patients. And from there, you can just see the pathway to then setting goals and building treatment. I think as OTs, we like dabble on doing that a lot, where we're trying to like figure out what's valuable or what people value. But I love how you did that so explicitly and saw that working. I know that you're in this research role and have also been researching topics related to this. 2-part question: how'd you get from practicing to researching? And 2, tell us about your research.
Sure. So yeah, it was never my intention to be a researcher. I wanted to become an OT to help people with cancer, but I really just fell into it, which sounds like such a cliche, but actually the way it came about is that I became really interested in this topic of ceremony and ritual during my OTD. And I thought, this is an interesting sort of therapeutic activity. I wonder if there are OTs out there who are using this in practice. And then I started researching, and I approached Florence Clark, who was the dean of the USC OT school at the time and a researcher herself. And I just brought it up to her. I said, what about this idea of ceremony? Are people doing this in practice? And what do you think? And she said, you should do a PhD. That sounds like a PhD. And I had never thought about doing that. But
like, that wasn't the answer I was looking for.
No, I thought that I could do a little, just do it in practice. But she's right. It is. I mean, it's such a huge topic and it's so interesting to me. And so I ended up, becoming her mentee and doing a PhD. And again, always thought I would return to practice. And I did. After I did my postdoc, I went back to practice at Cedars-Sinai for 4 years. And I did OT and research at the same time with patients. And that was really awesome. And I'm glad I did it. But now I'm focusing full time on research, which is also really awesome, But I did, while I was doing my postdoc at the National Cancer Institute, I was able to look at actually some issues around purpose and meaning in big data, which was super interesting. So I did this paper where we looked at a cohort of 5,000 cancer survivors, approximately, and we found that spiritual peace and life meaning, which I think of as a synonym for purpose, might actually decrease the effect of anxiety on physical well-being. So like the more purpose you have, the more you're buffered against the bad effects of anxiety. So that was super cool to me. And it showed that like there's something here, like this is worth pursuing. So now that I'm here at USC doing research full time, I'm working on putting together a pilot study to test the effect of a self-generated ceremony or ritual program on sense of purpose, meaning, resilience, post-traumatic growth. And I am really excited about that. So I'm going to get to do the intervention as an OT, which is I was doing at Cedars. And also, actually look at the effects in a systematic way to see if it's helping people, and if so, how. And I'm working in collaboration with the chaplains here to do that. So it's going to be a really interesting collab.
Wow. Mm-hmm. Oh, I just love this story, from your personal interest to practice to research, and then circling back to running this pilot program. And to me, it feels like a cohesive story. I'm sure it felt all over the place
like
at the
time. Hasn't felt super cohesive, but I do see the thread, I guess, in retrospect. Yeah.
Yes.
And as you pointed out, it does have a lot to do with meaning and purpose always. So.
Mm-hmm. Yeah. Yeah. I think as OTs, so many of us were drawn to OT because of this focus that we have on purpose and meaning, but it's not something in my mind that we've done well enough at like claiming explicitly, either in our practice or even like tying our work to the research that's growing behind sense of purpose. And I'm hoping that that is something that starts to change for us, where we really claim this practice area and lean into it, because it feels very powerful and feels like something that's effective for us. Thinking of this research article that really, I think, did a nice job of summarizing what we know about purpose currently and its association with all these health benefits, and then kind of alluding to the possible physiological reasons why that may be. I'm curious. I really enjoyed it as like a really high level intro to this topic. I'm curious, with your more finely tuned knowledge of this area, just what you saw in the article, what stood out to you.
Oh, I loved it. I'm so happy that you put it in front of me, because it is, like you said, a perfect just summary of everything that is already known, which is even more than I thought about the health benefits of purpose. And then what I really appreciated was their emphasis on change in purpose over time, rather than a cross-sectional association, which is sort of the work that I've done in the past has all been cross-sectional. And that helps us really see what might happen if we intervene on life, meaning, and purpose. Like, we can really expect to see all of these positive outcomes if people change. And it really highlights the fact that you can change, that you're not, if you don't feel like you have a sense of purpose right now, you can change that. It's changeable, it's intervenable. And that has been really heartening for me to see. And then also just the fact that they identified the possible mechanisms behind it is very powerful, because I think people from different backgrounds like to know why, that it helps them feel confident in what you're doing if you can identify, and here's why we think it works. So yeah, I loved the article.
Something I've been mulling over today related to the article, and I'm curious your insights on it, was thinking about a disruption in health and purpose, and how, or a disruption in sense of purpose, and how so many times as OT, we see someone who just had a stroke, has a new health diagnosis. And part of what they're going through is a disruption in what I saw as my sense of purpose before is changing, or has been just disrupted. And I'm curious, just from your experience working with people with cancer, how actively you address that, like that things have changed, like even in that values checklist and what my day looks like, that's probably changed from a year or two ago, and how you think about that disruption. Like, this article was so focused on like positive change in purpose, but I'm like, so often we're seeing people where their sense of purpose has been changed in a negative way, and we're trying to like get at least back to a baseline or better.
Right. I mean, that's interesting. I feel like I rarely see someone whose sense of purpose changes in a negative way. Ultimately, it's a pivot that happens. And I do think, a serious illness or injury is great for that, for, helping people identify where the purpose that they had just is not feasible anymore. It's not working anymore. But ultimately, you can always pivot and find a new focus, a new purpose.
Yeah.
And that's part of what we can do as OTs, is help people say, all right, that's okay. You used to be feeling like your whole life purpose was around this thing that you can no longer do. Okay, who are you now? And that's part of what the ceremony is for, is to say, what are you stepping into now? Like who are you now that you weren't before cancer, in a positive way? That's sort of the whole concept behind post-traumatic growth, is that you can frame almost anything as meaningful in a positive way. Not to invalidate the negative things that happen during something like cancer. Of course, it's horrible for many people, and it's not to say that it's all sunshine and roses, but I do strongly believe that you can find positive meaning in pretty much anything.
Yeah, it just makes me think, as OT professionals, we are just here at this really tender time where there's usually a disruption that's happening, but there's also this like opportunity window for like a reawakening and refocusing on sense of purpose. And I'm even like, is being part of that journey part of what makes OT feel so meaningful to us as professionals? Like, it's not really just the activities, it's that we're part of this like really deep shift in sense of purpose.
Yes, we're there to witness sometimes a watershed moment in someone's life where they become a different person, physically, emotionally, spiritually, whatever it might be. And there is such a beautiful power in being able to be there just to witness that, to honor it, and to help to facilitate positive growth out of whatever life has been throwing at our clients.
Mm-hmm. I think that just gets or teases out for me this idea that once you look at this sense of purpose research and have this language around it, you just see this thread so deeply in our OT work. You're like, that's what we've been doing. And we just didn't have this language. We didn't have this research. And I'm excited and hopeful for us that we really claim this and start using this language. I think it will both help our own work make more sense to us and make our work more explainable to others.
Yeah. That's why
Do you agree that it's that foundational?
Yeah.
Like, have we been doing this the whole time and not talking about it in this way?
I think so. I mean, listen, I would be really curious to hear from someone who disagrees. I'm sure that there are those out there who might say that that's not true. But the way I like to explain OT to people who are just learning about it for the first time is, we're interested in how you occupy your time, right? That's why it's called occupational therapy. And further than that is how you occupy your time in alignment with who you are, like your highest self, your goals, your values, your sense of purpose. So even if your purpose, your sole purpose in life is to be able to do your ADLs independently again, great. Like, let's align our treatment plan with that. If your goal in your purpose in life is to run a marathon or become the president, then let's figure that out. Like, let's break that down into its components. Like,
yes.
Get you there. Like, I just feel like we can help facilitate any purpose, because any purpose can be broken down into baby steps. And that's OT.
Yeah.
Right. So, yeah. And I mean, I think one thing that OTs do that I think is really cool and unique is that we start out by, when we do an evaluation, we're doing an occupational profile, right? Like, we're doing an occupational history. We're asking about who the person is as a human being and what matters to them. And we're not just focused on, okay, what's wrong with you? How are we going to fix it? It's who are you? What makes you tick? And those conversations, I do feel like lend themselves more to this existential territory about purpose in a really beautiful way. And yeah, how can we be champions of people as they move towards that purpose? And that's something that we set ourselves up well to do, because we start with asking them about who they are and what matters to them.
Mm-hmm. And usually what we're asking, or what we're working on with behavior change is so hard. Changing your habits is so hard. We have to leverage sense of purpose because it's such a powerful motivator. Like when you go to the doctor's office and you just get a shot and it's really passive, they don't have to talk about sense of purpose because that's easy to be a passive recipient of that medical care. It's much harder to do what we're trying to work towards usually, which is usually a behavior change. So we have to use this tool because what we're doing is so hard. Usually.
Yes. And I should mention another interesting idea that I have, and I haven't tried this out yet, but another piece of research that I do, I'm thinking about it because you mentioned health behaviors. So I have a randomized control trial going right now here at USC, and it's part of my KO1 grant. And we're looking at whether a personalized OT intervention can help people with a history of cancer, colorectal cancer specifically in this case, to meet their health behavior goals, to adhere better to health behavior recommendations, specifically around diet, exercise, alcohol use, things like that. And just the OT in and of itself, I think, is really helpful. Like in pilot results, it looks like it's working, it's helping. But another wrinkle that I've been thinking about testing in the future is what would happen if we introduced an intervention on purpose and life meaning into that. If you asked people to kind of tie their health behavior goals to a larger purpose, and maybe even mark what they're trying to do ceremonially, right? Like my purpose is to live long enough to be able to, go to the beach with my grandkids. I don't know, something like that off the top of my head. Then, okay, let's do a ceremony where we help you claim, like, I am a grandparent who, is healthy and strong. And like, that's the identity that you really want to step into. That's your purpose. Okay, well then probably that's going to motivate you a lot more to eat your veggies and stop smoking.
Yes.
And maybe as much as no one likes it, well, get those steps in, because not just because we're telling you to, but because this matters to you, because you have a purpose in life and it's to get to this point. So I don't know. I'm interested in maybe trying that out to see if you can kind of take a purpose-oriented approach to health behavior change.
Yeah.
Wouldn't that be interesting?
And I think we have, yes, you have to do that research. And yes, we need to be leaning into that as OTs. I've done so many episodes recently on AI and how that's going to change practice so much. And things that are easy to do are going to be there's just all kinds of health tech companies that are trying to move into that space. But what you're talking about, connecting behavior change to someone's sense of purpose, and I'm that is such a uniquely human, very hard thing to do, that an OT, you need a person to do that with you. You need an OT to do that with you. So I'm we need to lean into that more than ever, because I think I can see that being the heart of our future jobs.
That is so true. Yes, because part of what I toyed with a couple of years ago was trying to make the RISE clinic, which is what was my Cedars-Sinai clinic was called RISE for cancer survivors. And I was thinking about how to make it more scalable, because it's expensive to hire an OT, to do one-on-one interventions with people. And I was thinking how much of what we do could actually be provided by, a website that, uses machine learning to ask you the right prompts at the beginning of every day, right? Like, how are you feeling today? Have you gotten your steps in today? Like some of the health coaching stuff. But yeah, I agree with you. I do not think that it would really be that effective if a bot popped up and asked you in the morning, do you feel like you've really been working towards your purpose today? it would sort of ring empty. Like, you can record what you ate today, and you can record your steps, and we can use AI for things like that. But no, there is such a strong spiritual and emotional connection to work around purpose, which is why I also think it's important to collaborate with people like social workers and chaplains in our work, because it can veer into territory like that. And I think getting input from those collaborators has really informed the way I do this work. And it totally cannot be done by a computer.
Yes. Like I said, we just work with people at such a tender time. I can't imagine someone just having had a stroke and sending in a screen to walk them through that. Like, I think that we should be sending in a person.
Mm-hmm. Yes. And it should be an OT.
And it should be an OT.
Who can then bill for the services, which is part of what's beautiful about it.
That's all this is very high level, and I could stay up there. I could talk high level so long about this. I want to talk specifically about OT assessment and treatment and infusing purpose into those two parts of our practice, starting with assessment. And thinking of assessment, I want to ask, what's like the easiest way to start incorporating purpose more into our assessment? How might we already kind of be doing it, but we could lean into it a little bit more? And what would be the next level of like really digging deep and assessing purpose explicitly? What would that look like?
Mm-hmm. Right. So I mentioned that I do think the way that we often start with an occupational history or an occupational profile is we're already doing that, right? And I think that sometimes that can lend itself to conversation about purpose, meaning. But another thing that you can do is, first of all, you can just consciously try to probe a little bit more in your initial eval about questions pertaining to meaning, values, like I mentioned, and then life transitions. I think that's another kind of topic that you can introduce in an eval when you're trying to understand your client and where they're at. Questions that I like to ask are, what do you feel like you're stepping into at this time in your life? What do you think you're leaving behind? So allowing your patient to not just say, well, I want to be able to, unload the dishwasher, which is really important. But beyond that, is there anything that you feel like you're sort of claiming as an identity now, as a person who's, let's say, just been through chemotherapy? And I would say most people have an answer to that if you have space and time to really settle in and let them feel comfortable. And I know it's harder in some practice settings. I was lucky enough at Cedars to be able to do this in an outpatient setting where I had 45 full minutes to talk to people. And it would definitely be interesting to hear a perspective from somebody who's, let's say, in an inpatient setting and you have much less time and maybe you're at the bedside. I know you might not have enough time to dive into this stuff, but I think little questions could help just kind of point to where someone might be in terms of their meaning, their life meaning, their purpose, their values, their identities. And then another thing is that you can include some patient-reported outcome measures. So I have used the FACIT, FACIT. I think it's the FACIT 12. I forgot. But it's basically spiritual peace and life meaning is what it measures. And it asks questions like just pertaining to feeling like you have a sense of purpose, feeling like you have a sense of peace. And it's not a long measure, and it's something that you can just kind of throw into a battery of questionnaires. If you're already using any patient-reported outcomes to look at quality of life or self-efficacy or anything like that, yeah, I would encourage people to just throw a standardized measure in that looks at life purpose. And there are several that you could use. And then you can even see if people are changing over time, which would be a super interesting outcome for any clinic, I think.
Yeah. And I can see if you do this more probing during the assessment, I can just see really clearly how like then you can write better goals. You can tie all your treatment back to those goals and that sense of purpose. And I think we do that on some level already. It's just leaning into that skill set even more and really owning it as one of the main drivers of our efficacy, even that's what makes occupational therapy unique and effective. Thinking about treatment, I want to ask the same two-part question. What's like the easiest way to think about purpose a little bit more in treatment? And then what's a deeper level to be addressing purpose and sense of purpose through treatment? I'm looping back in my mind to what I said at the beginning. Not everyone comes to our OT sessions with a sense of purpose. I'm thinking about those 20% of adolescents that say my life is useless. I think so often as OTs, we're trying to connect with someone's meaning and find out what's valuable to them. And sometimes people are just at a place where they don't have that. What does addressing that look like? Sorry, that's a hard two-part question. Okay. What's an easy thing we can do? What's like the next level? What does that look like?
Yeah. Well, okay.
In a short answer.
In 5 words or less. So, yes. Okay. I want to talk really briefly though about something you said, which is that people might not feel like they have a sense of purpose. And I want to unpack a little bit that word purpose, because I think it's a misconception that it's important to have some sort of grand purpose. Like, it doesn't have to be that way. And I really like the way Eckhart Tolle talks about purpose. I don't know if you're familiar with his work.
Or I know him overall, but not how he talks about sense of purpose.
Yeah. So he says that we all have a primary purpose, like an inner purpose and an outer purpose. And for him, the primary purpose is your inner purpose. And your inner purpose is just to bring your highest self, your awareness, your presence to everything you're doing in the now, right? And so I think that's a useful concept for people who maybe, let's say, have a lot of new limitations because of whatever health condition they have.
Yeah.
Their primary purpose might be to just bring their full presence and their full awareness and their best efforts to just learning to take care of themselves again. And that is purpose enough. Your outer purpose is your secondary purpose. And that can be what you're doing in the world. And then whatever that is, that can just be whatever makes you come alive, whatever makes you feel activated, energized, like yourself. And that doesn't have to be, I'm going to save the world. I'm going to end the climate change. I'm going to make $1 billion. I think it's possible that the reason a lot of people feel like they lack a sense of purpose is because of this, that we have a sense in our culture that we need to have some sort of save the world purpose or a big capital P purpose. But it doesn't need to be that complicated. I mean, if you really love your garden, maybe your purpose is just to make the most beautiful garden that you possibly can. You're not, saving someone's life or anything by doing that. But I would argue you're changing the world by making it more beautiful because you are more energized and activated in the world. You know what I'm saying?
Yes. Yeah, totally.
So I like to make sure to have those conversations with people when I talk about life meaning and life purpose. And I think something like cancer or any real serious illness or disability can be a really beautiful moment, a really crucial moment to recognize that. Like, oh, my purpose used to be to rise to the top of my company and be the president and, go on fancy vacations. And something like cancer, like you said earlier, can disrupt that hugely. and show you either that that's not possible anymore, or does it matter anymore? You know, like, what do I really care about? Maybe I really just want to show up as my best self within my family unit today. You know, I mean, you can only achieve your purpose in the present moment. There isn't a future moment that really exists. Like, you can only work towards your present, your purpose in the present moment. So
I love this framework so much.
Yeah.
I was a religion major in college, and I'm like, even if someone comes in with a specific, I mean, so many people have a specific religious, spiritual purpose, it still works in that framework. Like, your inner purpose of being fully present, you could connect to your religious purpose too.
Yep. Yeah. And
yeah, it's like a framework that is feels really flexible.
It's very flexible.
And there's nothing relate to whatever people brought in.
Right. There's nothing prescriptive that we're doing as clinicians.
Right.
If your purpose is, I don't know, you think of anything. If that feels like that's going to bring you alive, then let's do it. You know, and I like the quote from Joseph Campbell, "Follow your bliss." I'm sure you've heard it.
Yes.
I do feel I think it contains the spirit of OT in a way. Like, fill your day with what makes you feel good. You know, and not necessarily happy, right? Because let's say, I don't know, it would probably feel good in the sort of short term for me to like watch TV all day and eat chips, right? But like, that doesn't really make me feel activated, alive, you know? And so that's kind of what we want to help people identify is, you know, that should be your purpose. And in this way, I think because we can ground that line of questioning in concrete everyday activities and short-term goals, we can help people with this in another way that someone like, let's say, a psychologist or a life coach maybe wouldn't be doing. Because I think that there is a lot of overlap between working with people on purpose and meaning. There's overlap between OT, social work, psychology, chaplaincy. Like, there are a lot of different disciplines that I think touch on these issues. But as OTs, we make it so concrete and actionable.
Yeah.
And I
love grounding it in that 24-hour cycle.
Exactly. It all comes back to values and the balance wheel. Like, is the way you're spending your time aligning with what makes you feel alive and activated in the world? And if you use that framework, no matter how able or disabled you are from whatever life has thrown at you, you can still be pursuing the thing that makes you feel most alive. And it can change, as you said, right? Yeah. I don't think I really answered your question, though.
I was just thinking, you like answered the deeper level of like how we can really do that fully.
Oh, okay.
I think the lower level is just like, as OTs, we have goals that we're working towards, and how this article described purpose is working towards goals. And we can just bring those to the forefront even more to be like, we're doing this because of these goals. Like, that's a very low hanging fruit way that we're already doing it. And we're maybe not thinking of it as sense of purpose.
Yeah, I mean, I think...
But it is.
Well,
or like, it's like a short-term goal.
Yeah, the way we write goals as OTs, I think often already gets at the why, right? I mean, I think at least the way I was taught to do it, you know, you would say why the person wants to increase their range of motion in their arm. Well, it's because they want to be able to make breakfast for their kids, you know? I mean, that's already getting at sense of purpose. So I think just making sure we're asking questions about it, about purpose, meaning, and making sure that we're addressing both in parallel. I think it's something that we're naturally doing anyway. Like you said, maybe just even framing it differently in our minds, we can see that it's something we're already doing. And just kind of giving ourselves permission to have those conversations. You know, like, why is making breakfast for your kids important to you? Oh, you want to be the best possible parent? Oh, that's a purpose that you have.
Yeah, that's powerful.
So, yeah.
I want to talk about or ask you about how we talk about this powerful skill set of ours specifically in the biomedical model, like I can so see in cancer survivorship where you might be interfacing more with chaplains, and it's just a very specific practice area. If I'm an outpatient OT and I see this as like a huge part of my skill set, do I tell my doctors this is something that I'm doing? Do they care? Like, or if I'm a school OT, do I tell my principal if I'm really good at sense of purpose? Like, how do we talk about this with other professionals in some of our more traditional settings, or do we not?
No, that is a very important question. So I've had some experience with this. I mean, the setting that I was practicing in at Cedars, I was a bit of a lone wolf. Like, I didn't really have a lot of other OTs working in my area. And so I did find myself in a position of having to explain what I was doing to a lot of different referral sources, providers, colleagues. The way I talk about it, I don't usually talk about life meaning and purpose per se. I do like to talk about setting goals that are linked with a person's health-related quality of life. So I think health-related quality of life is a nice
is a nice, yeah.
into these things. You know, the health-related quality of life questionnaire, patient-reported outcome measure that I use a lot is the PROMIS Global 10. And that gets at basically every component of health-related quality of life, including your emotional well-being and things like that. And so I think if you were telling somebody, oh yeah, you know, we today in our therapeutic session in OT were, you know, doing a little ceremony to mark my patient's transition into someone who's claiming his identity as an artist, you know, which is like a real life thing that I have done in my clinic.
Yes.
You know, the way you talk about that is, yeah, we're working on the person's self-efficacy for managing their chronic condition, for managing their life. And we're working on, just getting them to a place where their health-related quality of life is optimized. And, you know, you can just use, I think, the more biomedical terminology to describe what we're doing, because that is what we're doing. I mean, this is a big quality of life issue, having no purpose, which is what the article is speaking to. If you have no sense of purpose, then you're not going to have your health outcomes will be worse. I think I'm trying to remember, but I think the article said your allostatic load is higher, right? Your lipid panel can be worse. And that would be my other piece of advice, would be to just point to the evidence, to really say, listen, if we are intervening on purpose, meaning quality of life issues, emotional, spiritual well-being, we are going to see better health outcomes. We are going to see less comorbidity. We are going to see, you know, I don't know. I mean, that's what I want to measure, is like, will we maybe see fewer, you know, ER visits? Will we maybe see like less healthcare utilization dollars down the road because people are feeling better? And feeling better has a cascade effect where you're just less sick. I don't know. I mean, that's what I hope to show down the line. But yes, pointing to the evidence, talking about the downstream effects of this type of work on, people's health-related quality of life and overall health, I think will help people understand what it is that we're doing and why.
I love that. And I'm thinking about just what I hope is a transition to more value-based care models too, where people are also just becoming more interested in levers like this, like something you can intervene on that has this wide-ranging impact for the long term, like sleep, like sense of purpose. I feel like our fee-for-service models have just disincentivized us from thinking about things like this. And I think we're headed hopefully into just this interesting reality where we have like we said at the top, there's the need, there's the science, but we're also going to have more business models that support it too. And people might be more interested in this than they've ever been if we really do transition to those business models.
Yeah. I mean, you know, you're an expert on the value-based care. I mean, that's something I want to learn more about. But yeah, I mean, I think that payers pay attention if you start telling them, listen, it's much less expensive over the course of a lifespan to care for a person who has a solid sense of life meaning and purpose than somebody who doesn't.
Yeah.
And I feel like the article points to that. Now,
Yes.
it'd be super interesting to see longitudinally if that continues to be the case. And if you could show that, how powerful would that be? I mean, then I would not be shocked at all if payers started offering incentives to take part in those types of programs. The same way that right now, you can get reimbursement for health behavior intervention programs from an insurance provider, because they know that if you improve your diet, improve your exercise, that you're going to cost them less money down the road.
Yes. Yes.
And if we could show the same thing about life, purpose, and meaning, then yeah, I mean, we could have life, meaning, and purpose clinics all over the place, helping people to identify, what makes them feel alive and how to actually get to that place, regardless of their physical ability level. So that's the dream for sure.
Yeah. I'm sold on the importance of this. I see an increasing importance as we head into the future. What do we as an OT profession need to do to prepare to embrace purpose more fully? Is it more trainings, more research, just rethinking what we're already doing?
Yeah.
How do we get equipped?
So, number one thing, I think it's important, and you've alluded to this a couple times, but it's important to advocate for the fact that we as OTs belong in this arena. This is in our wheelhouse. This is part of our toolkit. To intervene on life, purpose, and meaning is a therapeutic activity. We can bill for it. There's a CPT code for that. We can feel confident describing the outcomes of that to our colleagues. So I think, like you said in the very beginning, just owning it as something that's in our practice area is really important. And, something like, doing research, showing that the outcomes are there is really important. I would love to see, and I hope to produce myself, a research study showing, like the article that we're talking today, showing that those outcomes are there when an OT is at the helm of a purpose-based intervention. That would change the game, I think. So definitely I'm on it. I hope if others out there are doing this type of work and would like to collaborate, I hope they will get in touch, because it's something that we will work better on together. And that's another point, is just, kind of getting out of our silos. You mentioned how this type of work could be applied to a school-based setting with, adolescents, for example. It can be applied in an adult rehab setting. I mean, I think it's applicable to a lot of different populations, but if we're all doing this work separately, then it's going to be hard to sort of compare our results. So convening some type of, I would love to see, a conference proceedings about this, a working group about this, getting like-minded people who feel like this is important. Let's get them all in conversation, because I would love to know how other people are measuring things around life and purpose in their OT practice, how that's going, what they're seeing. These types of conversations have to happen. Otherwise, we're all just operating independently and we're not able to move as quickly.
Mm-hmm. Yeah.
So that's part of my goal, is just to get out there and kind of spread the word and evangelize and talk about it, and in the hopes that it'll at least generate conversation, if not collaboration.
Mm-hmm. Yeah, I get to hear the stories so often of OTs who are doing innovative programs in their practice and would love to collaborate with a researcher, but that sync has been so hard traditionally. If someone's really interested in sense of purpose, or they feel like they're doing it already in their practice, give me the really logistical things of steps of how they get involved in a broader conversation. For us on the ground, that's just like nebulous. And so, or I just see over and over again how it doesn't actually happen. Like the connection isn't actually made.
Okay.
This is like a bigger, like this is veering off, but like.
No, it's really important. So, okay, number one, present at conferences, present at AOTA, present at your statewide association conference, talk about your work, right? Like tell people what you're doing. That will help link people together. And then I think it's not hard if you're already collecting or you would like to collect outcomes about life purpose and meaning in your clinic. Like, let's say you're thinking, hey, I'm already doing some patient reported outcome measures with my patients just for, quality control. I might throw in the facet 12, right? Like, let me try that. You can do that. Like, you can collect the data for quality improvement, patient satisfaction reasons. And then you can go back later once you already have, let's say, 100 people in your clinic have filled out these patient reported outcome measures. You can go get an IRB approval from your institution, assuming that you're affiliated with an institution. If you're not, that's maybe a little harder. You might have to find an institution to help you with this, but get an IRB approval to go do a retrospective analysis of, your 100 pre and post facet surveys. You've just done a research study, you don't have to do anything fancy. But also link with a researcher. Link with me. I want to help people research this and figure out feasible ways to do it in all kinds of different healthcare settings. When I've presented this work to my colleagues here at USC, I had people in a lot of different practice areas tell me that they could see it being useful for their particular client base. So I presented specifically around my ceremony work, and I had someone who works with kids with autism say that she could really see this being useful for families, embracing, a new purpose of being caregivers for a kid with autism, after a diagnosis. Or I had another colleague who works with people with stroke who says, yes, like stroke absolutely disrupts everything about your purpose and the way you see your life. What about a ceremony for those folks to step into what their new meaning in their life is? So yeah, I think just talking about it, collaborating, finding researchers who can champion small pilot studies, and that's how it goes. And then we build the evidence base, and before we know it, it's standard of care.
Yes. Oh, I love thinking about those connections, and or just from my vantage point, I see so often how much we feel fragmented and siloed, but there really are ways to collaborate and are ways forward. And hopefully there's new platforms and tools and opportunities for us to collaborate. And sense of purpose is such a great area to think about, really spearheading that in and just ushering us into this new reality. We've talked about so many things today. I could talk about all of them a lot more, but what's the thing you want to leave us on?
Okay. So I guess I'd say two things. One, purpose doesn't have to be grandiose. It can be simple, and it can be an inner purpose, right? So, and on that note, I think as OTs, a really great place to start in thinking about this is with yourself. So I absolutely encourage everybody to do the values checklist exercise with yourself. You can Google it. It's there available for you. And to just spend a little bit of time thinking, if you haven't recently, about what these days in your life is making you feel activated, energized, alive. And doing that exercise with yourself is not only going to make you a better OT, but it's going to help you see how to do that work with your patients and your clients. So start with yourself, and it doesn't have to be big. It can be small, and it can change over time. And it's an exercise that I really recommend that people do all the time, like at least once a year. That's my prescription for everybody. Think about your values and think about your purpose at least once a year. And that way you never get super out of alignment. and then help your patients do the same. That's my takeaway from everything.
Well, Alix, we tackled this the big existential question of purpose, and you have made it feel so practical for us, really inspiring. I love how it could just interconnect us more as OTs, even across practice areas. And I'm just really thankful for this conversation and for your work on this, and I'm excited to see what happens next.
Thank you so much. Yeah, it's been a really interesting conversation and inspiring for me too. So thanks.
Thank you. Wow, you all, this conversation has me so jazzed up about sense of purpose and its importance to us as occupational therapy professionals. Meeting Alix and seeing her work is part of what prompted me to include sense of purpose as a core pillar of OT treatment. You can check out our visual that we worked on by Googling OT potential treatment areas. And I, of course, want to hear about what you think about this content, what questions you have, and if there are any resources you would like to see in the OT Potential Club to help you address sense of purpose. The OT Potential Club is also where you are going to go to earn a CEU certificate for your time today. So what you are going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are in there, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. Okay, I just want to thank you so much for joining us for this conversation. I hope this podcast helps keep you informed and inspired as an OT professional. Take care, and we'll talk next time.